Hey guys, Dr. Bergmann here again at Rosemary Jones Chiropractic. This week we don't really have a demonstration, but that doesn't mean that the topic's any less important, and that's chiropractic care during pregnancy. So a lot of times women will call in and they'll say I'm 12 weeks pregnant, or I'm 30 weeks pregnant, or I just found out I'm pregnant. Is it okay if I get adjusted? And it's absolutely okay to be adjusted while you're pregnant. In fact, we encourage it, and it seems like women that get chiropractic care throughout their pregnancy tend to have an easier labor, and I'll explain why here as we go through the video. So when you get pregnant, there's a hormone that's released that's called relaxin, and relaxin does exactly what it sounds like. It relaxes the soft tissues, the ligaments in the body, so as you grow and as the child grows, things are able to shift and move and expand and get out of the way. So the problem is that the relaxin hormone doesn't just focus on specific areas. It's a hormone that's released through the entire body. So any joint in your body, I mean even wrists, elbows, shoulders, knees, ankles, low back, cervical spine, neck, all of those things are being affected by this hormone. So as you go through the pregnancy and your body starts to change and the child starts to grow, it's easy for there to be some aches and pains, and that's pretty normal for that to happen. However, when that hormone's circulating, it's easy for something to become maybe hypermobile, or if it's restricted or immobile, it's not allowed to move like it wants to, and that's where the pain generator comes from. So when pregnant women come in, we do a specific exam and check them and see where exactly either they're A, hypermobile, or B, not moving enough, and we treat those particular areas to try to help decrease a lot of that pain. So a lot of times people will say, well, how am I going to get adjusted if I'm pregnant? I mean, if I've got a big belly and I've got laying on this table, that's going to be pretty uncomfortable. Well, our tables can modify. So the table's in the upright position now, and I can move this and change this position so that way when a woman stands here, their belly can be in this position here without there being a lot of pressure on the stomach. So this can change any position that I want, so that way it's most comfortable for the woman. Now when the table goes down, it's on a table. When I bring the table down, the table just brings you down then as well. So there's things that can be modified. There's things that can be modified in the office here to make it more comfortable, so that way there's no harm or risk to the child, one, and to two, the mom. So as we go through, it doesn't really matter what stage you are. We've had women come in, I just found out I'm 4 weeks pregnant. We've had women come in at week 35, 36, 38 that are almost to their due date. It doesn't matter where you are along in that process. Chiropractic care can be beneficial to help keep things where they need to be, and typically, like I said at the beginning of the video, women that have chiropractic care at some point or throughout their pregnancy tend to have a better labor, shorter labor, because things are able to shift and move like they are intended to, and from our experience and from our feedback from pregnant women, labor seems to be easier with chiropractic care. So if you know anybody that's pregnant, or if you are pregnant yourself and you're having any pain in the back at all, it is safe to get chiropractic care, and it is encouraged. So again, thanks for watching. I'm Dr. Dave Bergmann here at Rosemary Jones Chiropractic.